Hi, class. It's Dr. Lindner. Okay, we are finishing up the integumentary system. We spoke in previous videos all about the skin. We spoke about the epidermis, all the layers, the dermis, the two layers, the hypodermis. We spoke about the function of the epidermis, the dermis, and the hypodermis. We spoke about skin pigmentation. We spoke about um, skin cancer and the first, second, third degree burns. We spoke about vitamin D production, lots of stuff. We spoke about the hair. And now we're going to look, and we spoke about the glands. And now we're going to focus on the nails. And I like to talk about the nails and try and make it somewhat clinically relevant because when I examine my patients, I shake their hand, and the first thing I do, besides picking up their muscle tone by their hand grip, which is so very important. It's a telltale for mortality. But I also turn their hands over and I look at the nail and look at the integrity, the structure, the color, the shape, the size, everything can tell me a whole lot about their health. So the nails are made of keratinized epidermal cells. We have this free edge section here. This is what we typically clip. Here's the nail body. Typically it's pinkish, should be pink. Then you have the moon-shaped crescent structure called the lunula. Then we have the cuticle or the empochium. And then you have the nail root. And then behind the nail root is an area called the matrix, which again is made up of a bunch of stem cells. And these stem cells multiply and divide and push the nail upward in a similar fashion to the stem cells of the stratum basal layer, pushing the skin cells up to the stratum corneum that slough off. So it's a similar concept. So here we're looking at the finger. This is the finger. We're looking at this section. So here's the free edge of the nail. Now we move back. Here's the nail body, which is nice and pink. Okay. And we move further posterior. There's the lunula. That's the white part. Then we move back to the cuticle, which is stratum corneum. And then we move back to the nail root. And then further posterior to the nail root is the nail matrix, right? That's proximal to the nail root. It contains those stem cells, which are dividing cells, and it produces new nail cells, which push the nail in that forward direction. Okay. And then here's the skin of the fingertip, right? Where you have epidermis and dermis and even hypodermis. Okay. And then here's the bone. There's your distal phalange. So the nail is tightly packed keratinized cells. The nail body is the visual portion, and it's supposed to be pink due to the capillaries that are underneath here. And the nail root, which is buried under the skin layers. And the lunula is white over here due to the thickened stratum basal layer. And then the empochium, which is the cuticle, that's the stratum corneum layer. And then proximal to that is where we would have the matrix. And that's where the nail growth occurs. So the nail matrix below the nail root is responsible for the growth. How much growth is there? For average, you're looking at about a millimeter per week. In healthier individuals, it can grow a millimeter in just a few days. I feel as a doctor of chiropractic, I'm clipping my nails about 3 times a week so that I don't scratch my patients as I'm treating them. So everyone varies. I think in healthier individuals, tissue turnover is quicker. And I think that's a very, very good sign. Let's look at some of the things that we can see when looking at the nails. This is what we call clubbing of the nails. And I know in one of my videos where we talked about skin pigmentation, when we talked about cyanosis, which is bluing due to decreased oxygen, when it's severe, you can see clubbing where it becomes very thick, especially at that cuticle, and it just really like clubs downward. Everything is very, very thick. And we typically see that when there's severe heart issues or lung issues. Okay, you can see how thick it gets at that cuticle in late clubbing. Now, when we look at the nail bed here, this doesn't look pink, does it? This looks more pale or white. We'll typically see that in signs of anemia, where if there is an iron deficiency, or if we have a B12 deficiency, or if there's congestive heart failure, or malnutrition, or liver disease, or lung issues, severe lung disease. All right, we're going to see this when there's decreased iron, decreased B12, congestive heart failure, liver disease, and malnutrition. Okay, I took lung disease out of there. My bad. Yellowing of the nail. When it's yellow, yellow nail syndrome is when the nail thickens and the new growth slows down. And the result is this yellowish type of discoloration. Nails affected by yellow nail syndrome may lack a cuticle, and they can detach from the nail bed in certain places. It's typically a sign of respiratory disease, such as a chronic bronchitis. And in certain individuals, we'll see it with lymphedema, when you start to see swelling of the entire hand and arm, and the skin starts to stretch a bit. Now we have pitting of the nails, nail pitting, which looks like, you see these little pinholes in here. We typically see this with psoriasis. So if we see psoriasis in the back of the ears or the back of the occipital area, in front of the knees, behind the elbows, you want to look at the nails, and you can typically see these little divots. It's what they look like. It can also be related to some connective tissue disorders, which are pretty common, such as Reiter syndrome and alopecia, which is an autoimmune condition that causes hair loss. Here's another picture of clubbing, nail clubbing. You can see how thick it is around the cuticle and how it kind of bows downward. Everything's thick, 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 large and thick. So we typically see this with low oxygen levels. So we see that with lung disease. And we'll also see it with inflammatory bowel disease. We'll see it with AIDS as well, and some cardiovascular issues. Now, the opposite of nail clubbing is spooning, where it goes the opposite way, like a spoon, spooning of the nails. Often we'll see this associated with iron deficiency anemia, or a condition known as hemochromatosis, in which your body absorbs too much iron from the food you eat. We see this in the Mediterranean population. We'll also see spooning in hypothyroidism and also in diabetics. Here's Terry's nails, and what you see in Terry's nails is this dark band right here. It's that dark band. Sometimes it's attributed to aging, and in other conditions, if it's not aging, then it could be liver disease, heart failure, and diabetes. So you're seeing a pattern that once you know what a healthy nail looks like, anything other than that is abnormal. Okay. Then we have Bowes lines. Bose lines is these indentations that run across the nails. Okay. And it's named after the physician Joseph Honoré Simon Baux. Okay. Now, it could be a sign of malnutrition, heart attack, liver disease, severe infections like mumps, measles, strep, scarlet fever, pneumonia, and it can also be seen in zinc deficiencies. So you could see these depressions going across in this way. Okay, there's some severe sort of illness that's going on with these. You can see Bose lines again. You start to see that these depressions going across in this fashion. Again, serious type of infections, scarlet fever, measles, mumps, pneumonia, even zinc deficiency. Now we have blue fingers. You can see there's bluish going on here, which is cyanosis. And it's a sign of various disorders. Sometimes it can be very cold in cold temperatures, and that can temporarily slow the blood flow to the fingertips. So they turn bluish. And then as soon as you run them under hot water or warm them up, then they get their color back. We could see it with an autonomic nervous system disorder called Raynaud's disease, where the fingers turn blanche, then they turn blue. They become numb, tingly, and painful whenever exposed to cold. Okay, so they turn white, blue, and then they can turn red. And it's a problem with oversensitivity to the neural system. It's this autonomic neural system imbalance that can affect fingers, the toes, the nose, and the earlobes. And people that have this typically have to go to warmer climates. Now, also, it can be blue when there's decreased oxygen, right, causing cyanosis. It's when oxygen levels decrease. So in asthma, emphysema, COPD, chronic obstructive pulmonary disease, which is the same thing. For those of you who don't know, that's what a cold is. You just don't know. You think like when you're not feeling well and your nose is stuffy, you go, I got a cold. But cold stands for chronic obstructive lung disease, which is the same as chronic obstructive pulmonary disease. Okay. If you go up high altitudes and the oxygen levels deplete, and overdosing in certain drugs like narcotics, benzodiazepines, and many sedatives. And you have to be careful also with silver supplementation. Silver can cause blue man syndrome, so you want to be careful with that, especially colloidal silver. You want to be careful with that. I use one in my office that's antibacterial and antiviral, and it's called silversilin. Silversilin sounds like penicillin, but doesn't cause any of the bluing. Also, I had a patient that had this a few years ago. This is a sign of a type of cancer, skin cancer that shows up in the nail, and it's called the subungual melanoma. Subungual melanoma, common in people with darker skin, darker complexion. So again, this is why you have to be very thorough. I like to be very comprehensive and thorough with my patients. Again, I greet them, I shake their hand, I turn the hand over so I can inspect their nails. This looks like candle wax dripping. Now, in some people, this could be normal, but it could also be indicative of an endocrine disorder. So always want to look at all their hormones. Let's rule out diabetes. Let's rule out thyroid disorder, Addison's disease, and B vitamin deficiency. It takes about, if you lose your nail, like if you've ever closed your finger on a door or a hammer, missed the nail, and it hits your finger, all of a sudden, within a few months, the nail will fall off, and could take about 8 months for the nail to completely grow out. A lot of students ask me about white spots that are on the nails. What is that caused by? It's called leucantia, and it can be caused by trauma, but it's also commonly caused by decreased zinc, decreased protein, or people that consume too much alcohol. When nails are brittle, it could be a sign of a thyroid issue, but also deficiency in biotin and iron. When there's decreased biotin, it affects the skin, hair, and nails. So there's a lot of supplements out there that are called HSN, hair, skin, nail, that happens to have biotin in it. Okay, we know that club nail is typically seen with hypoxia or lung issues. We know that spooning of the nails can be seen with iron deficiency anemia. It can be seen in diabetes. It could be seen with systemic fungal infections and B12 deficiencies. When you get those bow lines, which are those transverse depressions, there's definitely some sort of acute severe illness that's there. I've seen it in people that are going through an acute severe illness like cancer, and they're recovering from chemotherapy. Splinter hemorrhages, these are like red-brown linear streaks. These are seen with bacterial endocarditis and even trichinosis, which is a parasite that people can get from eating raw food or sushi and things of that nature. And then paresthesia is when people are anxious and nervous and their fingers are always in their mouth, and there's yeast that's in your mouth. So when you bite your nails and you get a little cut, you can get a type of infection near the nail root due to that inflammation. It can happen from manicuring, can happen from biting, bacteria and yeast or fungal overgrowth that makes it into that cuticle region. It gets hot, red, and inflamed.